Hi everyone, welcome to Health Highlights. This is a show about health professionals and the people and the stories behind the names that we often hear about but we seldom get to meet. And today it is an absolute privilege to be interviewing the CEO and founder of JettProof, Michelle Evans. Welcome, Michelle.
Thank you, it's good to be here.
JettProof is a calming sensory clothing store that is based right here in Lake Macquarie. And just this year they won 4 business awards in the Lake Macquarie Business Excellence Awards, including Business of the Year. So after 1 year of trading, JettProof went international. And they have an incredible aim that they actually put the business together with, which is to improve the daily lives of individuals and families living with sensory neurological conditions globally. I just love that you're trying to help the world. That's fantastic. So, Michelle, can you just tell us quickly a little bit about what calming sensory clothing actually is?
So it's a special type of sensory-based compression that we use called Calmtex, where the body doesn't build a resistance to the fabric. So it calms the sensory system down and it helps any child or adult with SPD or sensory processing disorder for their system to make sense to them, as well as regulating their system so they don't get anxious. And it has a massive impact on a lot of things, including meltdowns, learning and focusing, and so it's just a special fabric and a special the way we manufacture the product to calm the whole system down.
Fabulous. So it's an interesting business to be in. So I just love the passion and the why behind the reason of JettProof. So Michelle, would you be able to share us a little bit about the story and the passion behind
Sure.
this business?
So when my son was 18 months old, he started to, which is Jet from JettProof, he started to not sort of listen to us, and we thought he may have had a problem with his ears, so we had his ears checked and they were fine. We went to our local doctor and he said, you really need to see a paediatrician. So we went to a paediatrician, but it was a 6-month wait. By the time we got to the paediatrician, I was a few months pregnant with my 4th child, and he said, oh, he's got a few traits, but I don't think he has autism, and but go and see a psychologist. So we had to book in for a psychologist, which was a few months wait. We got to the psychologist and they couldn't actually assess him. They couldn't get him to stay still at the time, and so we went to another psychologist, and after 4 assessments, the 4th assessment I was in hospital with a 2-day-old baby. And my mother came in with Jet and said he has severe autism, severe sensory processing disorder, severe global development delay, and is classed as non-verbal. So. Wow.
And so how was that journey for you, having a child that was having so many problems? I'm sure it would have been pretty tough.
It was really difficult with a newborn baby at the same time. So when I got home with this a 4-day-old baby, Jet was having 10 to 12 meltdowns a day, and he was trying to self-harm and just trying to keep the baby safe and control him at the same time. My husband had to go to work every day at 6 a.m, so I was on my own, and I was pretty well locked in the house until Sundays when he had the day off, and we only went out for about an hour. It was all too much. The fact that he had no fear, and he was so severe and he had no idea what I was saying, it was really overwhelming, and I was just basically researching every time, all through the night, just researching. Number one thing I really wanted to do was to stop the meltdowns, because I could really see the pain in his eyes, and when you're going through 10 to 12 meltdowns before lunchtime every day, you just really want to help your child. So that's where it all started. After speaking to an OT, and I put a very thick wetsuit vest on him, and basically the OT said I could use it for 20 minutes to half an hour, but no longer than that each day, otherwise his body will build a resistance to it. And when I got home that day, my older children were saying, Mum, what have you done? Like, he's sitting at the table with us, what have you done? And I said, well, I just used a vest, for this weighted vest, but I can only use it for 20 minutes to half an hour a day. And next week when we visited the OT, she said, how's it going? I said, it's great for that. You know, I can put it on him for 20 minutes to half an hour and get an hour of relief. But what about the other 23 hours in the day? I need something else. And I researched all around the world and I could not find anything. And with a clothing manufacturing background for the last for 14 years, I realised that I have to make something, I have to help him. So I made some prototypes and tried them. And I saw that the meltdowns, instead of having 12, the next day he only had about 9, and they were milder. And by the next day it was 7, and it just kept going down. And by the time I got to Saturday, we had a massive meltdown on a Saturday, but the rest of the time was okay. And then the following week it was only a meltdown on a Saturday, every Saturday for about 3 months. And after that, the meltdowns completely disappeared. And he, as of Christmas this year, it'll be 3 years since he's had a meltdown.
That's amazing. Yeah. That's amazing.
Thank you.
Particularly with what we have been going on, to see such an incredible result in your child. So that's one thing, is as a mother just seeing a need. But how did it come to that you actually started a business and actually saw an opportunity to actually help more people?
Well, I was actually in an early intervention group, and I decided to ask a few of them if they'd like to try it. It was working really well for Jett. And so I had a few of the mums in the local area in Newcastle have used it for their children. And, you know, my family came to me and they said, I know you're absolutely flat out, but you really need to do this. This is a really needed product with your background and your experience with textiles and clothing. They said, you need to do this. And so I basically set up in my garage. I strapped the baby to in a baby carrier, and I had Jett jumping around and bouncing around, and I started drawing out all the patterns.
Fantastic. I love that. I just love that the whole reason for the business came out of an experience that you've had, and then you've just thought, I want to help people. And that's really what JettProof is all about, and I just think that's fantastic.
When Jett was first diagnosed and I was going to buy sensory products and things for him to help him with his sensory needs, because to me it's not really the autism that's the issue, it's the sensory processing disorder that goes along with autism that is the hardest part of raising a child that has those needs. And everything was made in China and the prices were inflated, and I said, I can't do this. I need to manufacture in Australia, I need to create jobs in Australia, and I need to have a product that's affordable. And so we were really determined to keep the price down, to make it affordable so everyone can have it that needs it in the world.
Wonderful. Well, thank you, Michelle, for coming in, and thank you everyone for tuning in. If you want to find out more about JettProof, you can jump on their website, which is www.jettproof.com.au. Or there was an incredible article written in the Herald Weekender just this weekend gone. You can jump online and Google the Herald article, and you'll be able to read a little bit more about JettProof. Look, thanks for joining us. Next week we have an incredible interview with Tim Walker, Dr. Tim Walker. He is a gastroenterologist at the Mater Hospital. He's also the head lecturer at the university, and he's going to talk to us about irritable bowel cancer, and reflux and other things related to gastrointestinal health. So you don't want to miss it. There's some new initiatives and some new things coming out that he's going to talk to us about, which I'm sure that you're going to be very interested in hearing about. So until next time, remember that healing is a gift, health a responsibility. See you next week.
Bye.